Concerns and questions as summer colds appear to be on the rise now, or could it be COVID?
Should we be getting tested? Western Mass News reporter Leon Purvis joins us now live in Springfield after getting answers from some local medical professionals. Leon?
Jordan, Chris, the biggest thing doctors tell me that they're hearing from people is that if their children or them have the sniffles and a scratchy throat, could it potentially be a case of COVID?
The big problem we have this summer, of course, is that we're dealing with still in the middle of a pandemic. We're not done yet with this.
Dr. John Kelly, a pediatrician at Redwood Pediatrics, says appointments for cold symptoms and phone calls are up. But he tells Western Mass News this time of the year that is expected. However, with COVID-19 still a concern, he says differentiating the symptoms is very important, especially when deciding whether to get tested.
If you have other significant symptoms like fever, body aches, then I would think that I would consider that we really should be testing them for COVID and make sure that isn't that, especially if the child is in some sort of public setting like in a summer camp.
Dr. Kelly suggests if you do have a cold, you should stay at home and not be around other people. But you should take note of who you've been exposed to and the timelines of when you got sick.
So typically, if you have exposure to someone with a cold, usually you're going to get sick from that within 1 to 3 days after you get exposed. COVID can be 2 to 14 days later. So you get exposed to someone 10 days ago that had COVID, and then you can come down with COVID symptoms.
One Springfield resident we spoke to says he's not too concerned.
Honestly, what we're normally seeing, but because of the pandemic and the COVID, a lot of people are still in the fear, so they have that in their mind. So a regular sniffle, they don't realize it's just the weather patterns changing the way it always has been.
Coming up tonight on Western Mass News, at 6 COVID cases going up in Springfield and how antibodies could rev back up if a fully vaccinated person is exposed to someone with COVID. Live in Springfield.